Hi, this is Dr. Shivakumar, MD Pediatrics Fellow in Neonatology. Actually, we are approaching to rainy season, so we have to take care of children from affecting from respiratory illnesses like bronchiolitis, bronchopneumonia, bronchial asthma, etc. Generally, in these type of respiratory illness, majority of symptoms like cold, cough, fever. Actually, these are the early symptoms in the respiratory illnesses. When the child having respiratory distress, fast breathing, chest drawing, and cyanosis, these are the late symptoms and signs in the respiratory illness. Actually, first we have to prevent these illnesses affecting your child by taking proper precautions like avoiding in rains and take away from the cold weather, etc. Now, I have to explain some of the early signs of these illnesses. Generally, up to 2 months, normal respiratory rate will be less than 40 breaths per minute. From 2 months to 1 year, normal respiratory rate will be less than 50 breaths per minute. 2 to 5 years, normal respiratory rate will be less than 40 per minute. If your child is having symptoms of fast breathing, then if the baby is less than 2 months, it will in the respiratory rate will be more than 60 breaths per minute. If the child is 2 months to 1 year, respiratory rate will be more than 50 per minute. If it is your child is greater than 1 year to 5 years, then respiratory rate will be more than 40 breaths per minute. Then next symptom or sign will be chest drawing. Now, how do you identify chest drawing? When the child is having fast breathing, there will be a retractions at subcostal retractions and intercostal retractions. This will indicate there will be worsening of respiratory stress. Usually, the symptoms is like chest drawing. Then, if the child suffers more or illness worsening, then the child having lethargic cyanosis. What is cyanosis? There is a bluish discoloration of lips, palms and soles, and ear lobes, etc. If the child is suffering with cyanosis, the respiratory distress is worsening. So, meanwhile, we are discussed about the most common symptoms like cold, cough, fever, and respiratory illness. Then, worsening signs and symptoms like fast breathing, chest drying, and cyanosis. Then we have to know when to take your baby or child to nearby hospital or expert OP for expert opinion. If the child is suffering with cold, cough, and fever, for fever, if you take any antipyretics, only with the advice of doctor, pediatrician, or experts. If the child doesn't asymptomatic within 5 days, or your child symptoms worsening like fast breathing, chest drawing, and cyanosis, you have to take your baby to the nearest hospital or pediatrician for a better care. Thank you.